audience, please sit down. The next agenda is speech from Head of STIKes Muhammadiyah Ciamis, Honorable Mr. Nur Hidayat, SKM, MM.
Innal hamdalillah nahmaduhu wa nasta'inuhu wa nastaghfiruh wa na'udzu billahi min syururi anfusina wa min sayyiati a'malina may yahdihillahu fala mudhillalah wa may yudhlil fala hadiyalah. Asyhadu an la ilaha illallah wahdahu la syarikalah wa asyhadu anna Muhammadan abduhu wa rasulullah nabiyya ba'dah.
Mohon maaf Pak Ketua, belum terdengar suaranya.
Oh ya. Halo? Suara lu?
Sudah masuk Pak Ketua.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Innal hamdalillah nahmaduhu wa nasta'inuhu wa nastaghfiruh wa na'udzu billahi min syururi anfusina wa min sayyiati a'malina may yahdihillahu asyhadu an la ilaha illallah wahdahu la syarikalah wa asyhadu anna Muhammadan abduhu wa rasulullah nabiyya ba'dah. Allahumma salli wa sallim wa barik ala Muhammad. Kita pakai bahasa Indonesia. Pertama, marilah kita panjatkan puji dan syukur Allah Subhanahu wa taala. Hari ini Allah perkenankan kita bersama-sama berkumpul walaupun lewat Zoom, ada yang langsung di auditorium. Saya kira ini adalah berkah rahmat Allah yang senantiasa melimpahkan karunia-Nya kepada kita sehingga kita masih dalam kondisi sehat dan bisa bersama-sama belajar di STIKes Muhammadiyah Ciamis. Salawat dan salam marilah kita atas Muhammad sallallahu alaihi wasallam. Yang bersama-sama STIKes Muhammadiyah Ciamis. Yang saya hormati para wakil, Kak Prodi, dosen, seluruh mahasiswa yang hadir, D3 perawat dan D3 bidan yang kami banggakan. Bapak Ibu yang kami hormati, pertama program ini saya kira yang sudah terstruktur. Nah, kita menginginkan visi yang unggul sesuai dengan apa yang kita harapkan, yaitu sekolah tinggi yang unggul dalam bidang kesehatan yang berlandaskan nilai-nilai Islam. Mudah-mudahan langkah ini saya kira tepat dalam rangka untuk supaya teman-teman mahasiswa lulus dari situ betul-betul profesional. Jadi profesional yang berkarakter. Di mana kita tahu bahwa profesional itu tidak ujug-ujug atau tidak serta-merta seseorang menjadi profesional. Nah, dalam kesempatan ini sesuai dengan ayat Al-Qur'an yang dibacakan oleh Qori, yarfa'illahu alladhina amanu minkum walladhina utul ilma darajat, ada dua hal yang kita harapkan. Di antaranya adalah teman-teman mahasiswa menjadi profesional dan punya karakter Islami sehingga nanti betul-betul diharapkan oleh masyarakat. Harapan-harapan inilah yang saya kira pada saat ini kita coba untuk interprofessional education. Di dalam pembentukan kolaborasi, menanamkan pengetahuan dan skill antar profesi dalam masa pendidikan, menanamkan sikap dan perilaku yang positif dalam kerjasama. Ini saya kira yang kita harapkan nanti betul-betul memahami bagaimana peran dan fungsi dari masing-masing profesi, dan sekaligus kita harapkan pelayanan yang betul-betul komprehensif. Kolaborasi antar profesi kesehatan sebagai satu upaya untuk meningkatkan pelayanan kesehatan. WHO membuat Grand Design, pembentukan karakter kolaborasi dalam bentuk pendidikan formal, yaitu Interprrofessional Education. Saya kira untuk membentuk karakter, salah satunya adalah dengan Interprrofessional Education. Bapak Ibu, Prof yang kami hormati, pada kesempatan ini saya kira kuliah umum ini sehubungan dengan ada berbagai agenda kegiatan sehingga hanya diikuti oleh profesi bidan dan perawat. Kalau kita tahu bahwa di pendidikan STIKes Muhammadiyah Ciamis, profesi bersama-sama menangani masalah kesehatan. Sehingga terjalin kerjasama, komunikasi, saling memahami tugas dan fungsi tanggung jawab antar profesi. Memang permasalahan yang terjadi pada saat ini adanya gap antar profesi yang menyebabkan tidak terintegrasinya profesi-profesi dalam memberikan pelayanan. Di antaranya terjadi karena proses pembelajaran yang saat ini digunakan masih terfokus pada pencapaian kompetensi masing-masing profesi. Sehingga pada kesempatan ini, saya kira STIKes Muhammadiyah Ciamis membuat satu kegiatan kuliah umum di mana harapan bekerja sama dengan profesi-profesi yang lain, sehingga betul-betul bagaimana pelayanan yang diharapkan oleh masyarakat, yang kita harapkan adalah pelayanan yang komprehensif. Jadi mudah-mudahan dengan kegiatan ini, harapan-harapan yang kita inginkan terwujud di kemudian hari, dan kita kembangkan terus dalam rangka untuk memberikan pemahaman kepada calon-calon lulusan STIKes Muhammadiyah Ciamis yang nanti dengan profesinya masing-masing. Pada kesempatan ini saya kira kami sampaikan terima kasih banyak pada Prof. Muhammad Najil yang telah bersedia bergabung dengan kami yang kesekian kalinya. Alhamdulillah, saya kira ini satu kesempatan yang luar biasa dan sekaligus penghargaan bagi kami atas kehadiran Bapak bersama-sama dengan kami. Mudah-mudahan satu saat bekerja sama terus kita tingkatkan, dan sekali lagi atas nama STIKes Muhammadiyah Ciamis kami sampaikan terima kasih banyak. Terima kasih, mohon maaf billahi fi sabil haq fastabiqun. Assalamualaikum warahmatullahi wabarakatuh.
Nursing Diploma to lead our prayer.
Assalamualaikum warahmatullahi wabarakatuh. Allahumma sholli ala habati rasulillahi ajma'in. Amin ya Allah ya rabbal alamin. Alhamdulillahi rabbil alamin. Hamda syakirin, hamdan na'imin, hamda yuwafi ni'amahu wa yukafi'u mazidah. Ya Rabbana lakal hamdu kama yanbaghi li jalali wajhikal karimi wa azimi sultanik. Allahumma sholli ala Sayyidina Muhammad wa ala ali Sayyidina Muhammad sholatan tungjina biha min jami'il ahwali wal afat wa taqdilana biha jami'al hajat wa tutahhiruna biha min jami'i sayiat wa tarfa'una biha ghayati min jami'il khairati fil hayati wa ba'dal mamat. Allahumma ighfir lana dhunubana wa liwalidayna warhamhuma kama rabbayana shighara. Allahumma inna nas'aluka salamatan fid din wa afiatan fil jasad wa ziyadatan fil ilmi wa barakatan fil rizqi wa taubatan qabla al maut wa rahmatan indal maut wa maghfiratan ba'dal maut. Allahumma hawin alaina fi sakaratil maut wa najata minan nari wal afwa indal hisab. Allahumma razuqna ilman nafi'an wa rizqan wasi'an wa amalan mutaqabbalan وشفاء من كل تقبل منا إنك أنت السميع العليم وتب علينا إنك أنت التواب الرحيم ربنا آتنا في الدنيا حسنة وفي الآخرة حسنة وقنا عذاب النار برحمتك يا أرحم الراحمين والحمد لله رب العالمين. Assalamualaikum warahmatullahi wabarakatuh.
Finally, we come to the end of closing ceremony. To close the Alhamdulillah. Nasru minallah wa fatul kharib wa basiril mu'minin. Wassalamualaikum warahmatullahi wabarakatuh.
Assalamualaikum warahmatullahi wabarakatuh.
Seminar atau kuliah pakar dengan tema Interprrofessional Education yang akan dinarasumberi oleh Profesor Nazil bin Saleh, yang akan dimoderatori oleh Mrs. Aulia Fauzi, SST MKeb, sebagai dosen Diploma Kebidanan. Kepadanya dipersilahkan.
Terima kasih banyak Pak Dadi. I would like to thank you to Muhammad Nazil bin Saleh. Welcome to STIKes Muhammadiyah Ciamis, Prof. Assalamualaikum.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you for inviting me for this session.
Yeah, we such a honor for us to have you here in STIKes Muhammadiyah Ciamis, and glad to meet you here in STIKes Muhammadiyah Ciamis. Even we
Insyaallah.
Yeah, insyaallah. Amin. Selanjutnya saya akan menyapa seluruh peserta yang hadir di sini dan maupun teman-teman dan ibu bapak dosen yang hadir secara online. Assalamualaikum warahmatullahi wabarakatuh. Apa kabar semuanya? Baik ya, mudah-mudahan kita dengan maksimal. Sudah siap untuk materi kali ini? Oke, siap ya. Oke, before we start, I think I briefly to introduce you the curriculum vitae from Prof. Nazil. Here it is. Tidak bisa lebih besar ya, Pak? Her full name is Professor Dr. Muhammad Nazil bin Saleh, CSI PhD, is a professional in biomedical science. He has a PhD in molecular genetics and master's degree from the University Putra Malaysia and a BSc from biomedical science from the Bradford University, UK. He is currently holding position as a Deputy Vice Chancellor Academic for Faculty of Health Science at University College of MAIWP International, Kuala Lumpur, Malaysia. In 2019, he was appointed as an adjunct professor in medical technologies from the Mataram Polytechnic College, Lombok. Oh, sudah di Indonesia ya, Prof ya, pernah ya. And his achievement has been recognized in biomedical science, whereby he is the first Malaysian credentialed as a chartered scientist by the Science Council UK and fellow members of the Institute of Biomedical Science IBMS and Society of Biology UK in 2014 and 2015 respectively. He has won several outstanding awards. In 2022, Malaysia Outstanding Personality Awards from Malaysia Education, anugerah tertinggi or the highest recognition during convocation of Polytechnic, Researcher Award in Biomedical Science from the Private Education Cooperative of Malaysia in 2017, and between 2016 and 2019, he has contributed tremendously a part of a task force of allied health profession Act 2016. Appointed by Malaysian Allied Health Profession Ministry of Health Malaysia. In 2020, was recognized as a molecular biology expert from International Federation of Biomedical Laboratory Science to assist in WHO documents review projects and tests which will benefit the development within laboratory medicine and biomedical profession. And an international event level, Prof. Muhammad Nazil is presently an executive council since 2016, and in the year 21, he was elected as a vice president of ASEAN Medical Technology, representing Malaysia. Banyak sekali ini ya, Prof, penghargaannya. Dan to date, untuk saat ini, beliau merupakan author dari 40 scientific papers which were participated, published, and presented in the national and international journals, seminars, workshops, symposium, and conference. Kali and international, of course. His unique relatively quiet demeanor, which can be deceiving, has become a trademark. He is always humble, but when he speaks, he does so with authority and facts. Okay, which are really based on his deep knowledge of biomedical science. He is a great role model of a researcher and will continue to be an inspirator. Beliau betul-betul menjadi pakar untuk pembicara kali ini ya, meskipun kita akan membahas mengenai interprofessional education, tapi dengan background atau testimoni yang beliau punya, tentunya ini sangat relevan dengan kebutuhan kita saat ini. Oh ya, saya belum memperkenalkan diri. My name is Aulia. Walaupun tadi Pak Dedi SMC sudah memberitahukan bahwa moderatornya adalah saya. Will be delivered in two languages, English and also Bahasa, because the audience today is from midwifery and nursing diploma. So, in order to effectively, right. Jadi sebagai pengantar mungkin sebelum Prof menjelaskan secara detail terkait materinya, teman-teman sudah tahu mungkin ya IPE atau Interprofessional Education itu adalah akar untuk teman-teman sebagai future midwife and nurses di kemudian hari itu bagaimana kita melakukan kolaborasi nantinya ya dengan profesional-profesional lain di fasilitas kesehatan. Mungkin begitu. Baik, kepada Prof Nazil, disilakan untuk menyampaikan materi.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Before I start my speech today, ingin rasa nak makan kari cendawan batang keladi. Girang terasa tidak terperi, bertemu putra-putri yang baik hati. Assalamualaikum warahmatullahi wabarakatuh. Yang saya hormati Madam Moderator, STIKes Muhammadiyah, Ciamis, and also all students, basically from midwifery and also nurse, and also others program, I believe, if they are joined in this platform. Okay, today my topic, when we're talking about the interprofessional education, I think it's a very for the midwifery and also nurse. This is very important because at the end of the day, we working as the allied health professional, we are communicate between other professional or other allied health professional in everywhere in the country. Because it's very good on the communication. We are proud. Our nurse, our graduate D3, now already accepted working in Germany. So we have about 30 alumni right now working as a nurse in Germany, in Europe, and also in Japan. And another one, inshallah, by next month, we will send our student 36 nurse will be do a clinical attachment in Seoul, Korea, and in September there is about 79 students will be going as well. So in this case, I believe is a communication is very well to make sure they are understand properly in terms how you express yourself as a nurse, what I mean healthcare. It's not only communicate with the patient, you communicate with others, professional uh, platform as well. That's why my talk today, I will talking about professional communication for midwifery and also nurse. Okay, I try share my slide to everyone. Can you allow me to share the slide?
Materinya sudah ada belum, Pak Adam? Pak Adam.
Because I can't share my slide.
Would you give us your material?
By email.
By email, okay. To
Okay.
auliaridlafauzi@gmail.com.
Can you write to the
Okay.
the chat? I
Pak
can
Wahyu,
send to.
Pak Wahyu, tolong dituliskan email. Email abdi punten diseratkan Pak Aulia Ridla Fauzi.
Because I
Prof Nazil,
yes.
you can share by yourself because our operator has make you a co-host.
Okay, right. Okay, that is better. Then I can share my multiple. But I still can.
Oh, still can.
Can you send your email at the same time? I send to
Okay.
your email as well.
Oke. Pak Adam, punten dituliskan nama saya, email saya auliaridlafauzi@gmail.com.
AUL
AULIA
okay.
DLA
DLA
FA
FA
U
U
Z
Z
I. I.
All right. Okay.
Gmail, at gmail.com.
Gmail.com. All right. Okay, I think I already sent to your email. Okay. Meanwhile, we're waiting to you because it's nurse. What I mean is midwife or nurse pelayanan is a very important. What I mean professional. I think it's all over the world because you are what I mean a part of the frontliners. For example, during a COVID-19. Day day and night. So another way around, we can say the professional as the nurse is I think is in Malaysia right now. Everyone looking for this job and also this program to enroll and now program as a nurse. So another way around, you don't need to pay anything because the private hospital will be pay your fee from day one until you completed your your program as a nurse. This is a scenario in Malaysia right now. That's why I think my talk today is more talking about the communication skill is very important, because without have a very good communication, you cannot communicate, and the interprofessional education between one profession. Is it the slides ready in over there?
Yes, I just received your email, and today our operator will share it.
Okay. So that is is a scenario in Malaysia right now, because we are just started, because the result from and the numbers of students that are interested in nursing program this year, we can see the trend is increases. People like to join the program because they are fully sponsored by the private hospital, whereby it's a confirmed job after they completed the D3 ataupun completed the diploma program. So insyaAllah I will communicate with Pak Nur Hidayah later on. Maybe we can get one student, the good one, to join us, percent free from ticket, from accommodation, and also there is we can make arrangement for that once good student from STIKes Muhammadiyah Ciamis. Okay, is it the slide is ready?
Okay, this is okay.
Correct. All right, okay, good. On the second slide, especially for the midwifery and also nurse. And then we're talking about, when we talking about the communication, just because you are I believe there's a lot of platform when we talking about communication in 21st century. It's not only from face-to-face communication, we also talking about tech. People talking in the IG, for example, there is a lot of communication platform. However, we have to go professionally. We help proficient communication. Next slide. Okay, the end of the day, I believe there is three objects to effective communication, and then we see the method to ensure effective communication has occurred, and finally to see the recognized growth as a leader is a very important, because we need to communicate, to express ourselves daily. Next slide. When we trying to explain why they are so effective, we speak of strategy, vision, and powerful ideas. But in reality, is much more primal. I think it's a like primary is a basic things where we communicate. Daily communication. Next slide. So from that, you can see it's a very important. We communicate process. the first thing we're talking about the words that we are used. Either we are using layman terms, or we talking about the professional words when we talking to the patient, and then we talking about the body language, how we react, how we our body communication either with the patient or with the other people. And finally, it's a very important, we're talking about the tone, pitch, and also speed. So from the words, from the body language, and also from our tone of our speech, will be a lot of the expression from the words come out from our mouth. So we can see the expression, either the happiness, we're talking about a lot things during our communication. Okay, next slide. When we look on the communication, there is about six. First thing, we're talking about human interaction. Either we're talking about verbal, orally, or we're talking about non-verbal. For example, like people using a sign language, for example. Okay, we're talking about written or unwritten. We talk about planned and unplanned, and the way how the message, thought, and also idea. This is a very important. And the third one, we're talking about the transmit the feelings, the emotion, and then we're talking about the exchange various things as well, how we react to the communication. Next, the effective communication. Normally, we look on the interpersonal levels. Self-talk. We're talking how clearer when we talking about the communication. For example, I believe in nurse, for example, the way how you describe the drug, for example, to the patient, and then like midwifery, how you explain, how you give the instruction to the patient. We have to remember, because our patient is not come from, for example, we have to communicate equally to them. This is a very important, because the end of the day, they know what we're talking about. Okay, and then we look on the client safety, the patient safety. We're talking about the collaboration with diverse team challenged by current healthcare environmental, because now this during the 21st century, some hospital, for example in Malaysia, they are using paperless, which is there is no everything in the system. For example, how we give the information to them, this is a very important. For example, like nurse, you have like shift morning and also shift evening. How you transfer the information between the nurse morning and also the nurse at evening, for example, in terms of take care the patient. For example, give the professional communication and also collaboration also is a very important. And other things we get as well, the way how we communicate, how we instruct the sub coordinate below us. This is a very important as well. And finally, we're talking about the available resources and technology, because now this, I believe everyone using a smartphone device to communicate. For example, we can accelerate using a device technology. For example, like in Malaysia. Next slide. And then we're talking about the way how we send, okay, source and encoder. We transmitted the message. We convey the message. What is the how words are transmitted channels? Because sometimes when we written in written in the record is not clearly described that the important message is a very important. And we're talking about people receiver, for example, that we receive the information, the way how we listener and also decoded and also the information finally, and also respond and also feedback of the all sort of the information that we receive, and also we send and we receive the, for example, in the interprofessional, for example, like nurse collecting result from the lab, for example. People in the medical technology, they have the result. How they interpret the information to the nurse will look into the patient. For example, how to dress, any injury of the patient itself, based on the finding, for example, like a patient with the diabetic, for example, how to swab, how to get the samples. So that is the technique. We need the healthcare professional, either in the lab, either in the ward, and also among doctors. So from that is a very important, we can see from the diagram, they're talking about the interpersonal variables and balance that between the process. Because I believe during that time, the channel of the messengers is a very important, in 21st century is a very important to convey the message to the all right. For example, next slide, we're talking about the verbal communication. We're talking about the pace and also intonation. We're talking about the simplicity. We're talking about the clarity and also visity. We're talking about the timing and also relevant. We're talking about the credibility. We're talking about the adaptability as well. So, for example, some experience last year in Seoul. Next slide. So when I visit the hospital, because now these people start replacing some nurse in certain ward, they are using robot. Robot will communicate with the patient. But at the end of the day, the robot cannot express, and also like the human cannot express their self as well, because there is no expression in terms of human and also robotics. As talking about the non-verbal communication, as I mentioned, we're talking about the body language. We're talking about the essential skill, observation, interpretations. This is a very important. Like at this point, we are at the different place, and I believe there is an audience over there, and I'm communicate alone here. So the way how I'm communicate with all of you over there, message from my presentation today is a very important as well. But again, as I mentioned, this is a part of the platform that we urgency for people traveling, because if you are traveling, you will be make like a contamination, and also sometimes can spread. We're talking about the electronic communication. Okay, this is a part of the electronic communication in hospital, for example. When people in the in the quarantine, for example, and then after infectious, a lot of disease disease is caught a lot of the platform, for example. This is the part of the way how the technology will be. Next slide. We're talking about to get information, for example. Okay, like what we did today, we have a communication in terms of sharing the information and also experience. Okay, because the distance is too far, for example. For example, like the nurse to get some advice from other country, they can using the the electronic communication, effective written communication. Next slide. The way how people agent, okay, how to prescribe the drugs, for example, how to take the the medication, for example. This is the way how we communicate the communication process. There's a lot of factors can influence. For example, we're talking about the development and also gender. We're talking about the values and also perception. We're talking about the personal space. Okay, this is a very important. Sometimes people need their own, space in their life. For example, we're talking that kind of boundary. We're talking about the environment. We're talking about the attitude as well. So it's a very important communication techniques for children. It's a different how we communicate to children, how we communicate to elderly, how the way we communicate to and also category of people, for example, like sick people. So it's a very important. Okay, we're talking about the gender between male and female. Okay, I'm sure there is a different communication. We are Muslim, basically different way, the way we communicate between two gender. Okay, social culture. We're talking about the culture. We're talking about education. We're talking about the economic levels. Also, is a very important because once you are in the levels of education, after you have your own D3 or you have your diploma, the way how the culture characteristic is different. Next slide. Next slide. Okay, we're talking about the value and also perception. We're talking about the standard influence behavior. For example, we're talking about the value information. We're talking about the perception, personal view of any event. For example, this is a part of the types of the factors can influence the communication. Next slide. With the distance, okay, between how closer we are when we do a communication, there is a barrier between so we're talking about the space and also the things. Sometime next slide, we're talking about the privacy between one patient to another patient. For example, to give some privacy to the patient. That's why there is a curtain to make it the privacy to the patient as well, because I think it's a norm practices where the nurse do some treatment to the patient. You have to close the curtain because the patient need the privacy. As also relationship between sender and also receiver. We're talking about the informal with the colleagues. Okay, I'm sure after informal. For example, in the ward, we're talking about the formal communication between one to another. All right. So we're talking about the environmental. Environment is a very important, okay, between the patient and also the professional nurse, for example. How comfort the patient, how privacy the patient as well is a very important as well. So we're talking about and also non-verbal aspect match, for example, seen by nurse and also the client, for example. This is a very important as well, is a part of the type that influence the communication. Next slide, we're talking about the attitude. They have their own attitude. Is a part of the characteristic to produce a nurse with the attitude. For example, come to the work. For example, you have your own time. For example, we're talking about the interpersonal attitude. For example, we interact to the patient. What is the gap between patient and also nurse? Also is a very important during our day life. And finally, we're talking about the respect to the patient. Barrier to the communication. Sometimes we're talking about the stereotyping communication. Okay, we're talking about the agreeing and also the disagreeing. Either you agree or not agree with the the communication or argument. Okay, between in terms of one to another. Sometimes between colleagues. So we argue on certain example. to establish and also helping client, for example, and nurse respond to the contents, for example, with the patient. This is a very important, for example, the way how we turn the therapeutics communication. For example, is it the drugs did very well to you, for example, because this is a therapeutics communication. We look overcome the way do you feel. You also can describe to the patient based on the experience or based on your knowledge information. All right, we're talking about the empathy. Okay, we're talking about the empathy. For example, we're talking about the therapeutics, empathizing, for example, identification, incorporation, reverberation, and also detachment, for example. This when we look on the empathy situation to the patient and also to our colleague as well. Next, we're talking about the listening. I believe maybe like nurse or what I mean, they intend to listen the what I mean basically the comments, basically what I mean the doctor, for example. This is a part of what I mean the interaction. However, some information we cannot give any comments, so just what I mean listen properly in terms of having during that time. Okay, we're talking about the blocks to attentive listening. For example, we're talking about the rehearing. We're talking about being concerned with one's any interfere in terms of the information. We talk about the assuming, for example, and also filtering as well. This is a part of the blocks of the attentive listening. We're talking about the attending, because sometimes we are attending the patient. That will be from the either is a physical attending, face to face. What I mean, communicate with you with the eye contact, because we are communicate virtually at this platform. So we're talking about the silence, okay, using a silence because this is a part of the communication. Depends on the what I mean on the situation. For example, like elderly patient with the bedridden, for example, sometimes we just look on the in of the patient. So we know how they feel. For example, this is what I mean the silent, but we can show based on our expression of our face, for example. It reflects on the certain communication to the patient. Sometimes we are triggered to encourage the client to clarify, for example, on the certain situation, for example. Or information also, just the fact, for example, like we give all the information directly to the patient without any other information. Everything is just the facts. This kind of thing. This is what I mean the just the facts information. Okay, deflection. We're talking about the avoiding self-disclosure is a very important, because sometimes we cannot discuss what I mean directly to the patient, for example, because for example to elderly, for example, so we cannot like to give everything to the patient. We need to communicate with the family, what I mean the relative as the whole in terms of decision, for examples. All right, we talking to the patient and also to the parents, to the guardians of the patient as well. It's a very important on that, to the patient and also the nurse, for example, and also the nurse to the patient, for example, because sometimes the things that the patient not doing it, argument. And then we're talking about the pinpointing. Okay, this is a very bad situation. We try to avoid and also either the senior nurse to the junior nurse, and also to the others, party that involved in the argument. So we cannot like pinpoint point on the certain situation. All right. So we're talking about the giving back report, or any good or bad feedback is very important to. Is a part of the way how we improve on the certain process and also condition, for example. So all the complaints sometimes is not the bad, how we improve the system and also the scenario. And then we have to look on the focus on the feedback. So you have to look one by one all the feedbacks from the patient, from the colleagues, from the community, for example. So we have to go through thoroughly all the the comments. That's why it's a very important that in the hospital, whereby they can get feedbacks from the community, for example. Okay, the next we're talking about the confronting. Okay, this one is not good when we talking about the and also the nurse or the colleagues as well, because when we do a confronting, sometimes they can be the end of the day is a bad output. For example, when we talking about, for example, on the certain cases, we are confronting the stages. Okay, we look on the 6 skills. Okay, about the personal statement, for example. We're talking about the behavior description, for example. This is the confront skill that we need to address in ourselves, especially on the protocol. For example, sometimes we argue, there is argument between like a different hospital, they have a different way how to treat the patient, and then we start about the summarize and also processes is a very important to gather all the information that we receive, and then the layback, sometimes they're not using the right terminology like us. For example, like we see like, oh, there is inflammation, for example. I don't think so the patient know what is the inflammation all about, for example. So this is the way how we summarize and we look into it. All right. So we look on the therapeutic communication mistake, for example, common mistake, okay, giving to it, and also minimizing and also discounting feeling as well. This try to avoid it, because if you look thoroughly on that, that will be a negative failure to listen. Okay, because sometimes we are busy, we are not listen properly. That's why it's a very important during like we hand over between nurse morning action that they are giving to us, because some information will be affected to the patient as well. All right, it's very important. So we look on other things, for example, like we're talking about the growth facilitating processes. We're talking about influence by nurse and also the client, because sometimes there is involvement from the third party, for example, to influence other people give the advice. Okay, we cannot make decision for the clients, for the patients. All right, we're talking about relationship characteristic, as I mentioned, like either to the clients, to the patient, and also to the to our boss, for example. So we have to give respect accordingly. Communicate interaction, introduction. Okay, we're talking about the working, about the termination as well. This is a part of the a part of the therapeutic relationship. All right. This is a details. I think I not go one by one. There is about 5, and then we look on the 57. We're talking about the skill for the therapeutic relationship is a very important. Listen actively is a very important. we're talking about the help identify the client feelings, because some situation they have difficulty to understand. So you have to give the feelings on the situation. Be empathy also is very important to the genuine information, and also credibles is also is very important in terms of therapeutics relationship to the either to the patient basically. And then maintain the confidentiality is also is a very important, because I believe nurse will be keep all the, this is a part of our, you have to keep confidential in terms of the patient information basically. All right. So we're talking about the communication techniques to the children as also the family is a very important. Focusing, observation, okay, and then summarize information also is a very example. What kind of the to make it the children like it on the certain things. So you have to explore based on the characteristic of the patient. We have to basically to establish our rapport to the children. For example, this is the way how we communicate with the to the patient, to make it especially to the children, to make it they are comfortable to us. End of the day, after we have a very good rapport to the family and also the children, so you always communicate with, for example, like people in the lab, for example, there is a trust in terms of information sharing. This is a part of the information that we have to keep between two profession, and also between patient and client. Is a very good communication skill. Effective communication, large rule will be ability to deliver about the good things of the nurse profession in the in the world, either where you are working. Verbal, we talking about the written communication, and then also look on the others understand. Okay, show follow up, read prior to notes. This is a very important. And then the don'ts, leave blank space. For example, chat in advance, and the communication in nurse to be a good nurse in the future. With that, I end my presentation.
Give applause untuk Bapak, Ibu, dan rekan-rekan yang di online bisa memberikan reaksi tepuk tangan di Zoom-nya ya. Discussion dari teman-teman yang ada di sini, mungkin sudah ada yang ingin ditanyakan tadi terkait IPE dan kunci-kunci bagaimana membangun komunikasi yang efektif di fasilitas atau layanan kesehatan. Atau D3 kebidanan? Siapa yang akan bertanya? Baik. Ya, silakan maju Teh. Di depan. Boleh pakai itu klik di situ. Ya. Silakan kasih introduce dulu, namanya siapa? Ya, silakan ajukan. Ya. 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 Ya, bahasa Indonesia nggak apa-apa. Oke ya Prof, bisa untuk di mixing ya antara English and Indonesian?
Ya, bisa. No worries.
Silakan.
My name is Sofia Siti Adawiyah. Saya dari D3 Keperawatan. Izin bertanya terkait interprofesional antara keperawatan dan kebidanan. Kah ada batasan-batasan tertentu dengan bidan? Sedangkan kami di keperawatan pun ada keperawatan maternitas dan keperawatan anak. Mungkin ada batasan-batasan.
Oke, itu saja. Ya. Limitation of specialty in nursing begitu ya, Prof? Mungkin.
Oke. you need the answer. There we are. Okay. Are you talking about the between two profession between midwifery and also nurse, right?
Yeah.
Okay, to answer because it's a different country. Country they have a different way. For example, I believe in Indonesia, programnya memang telah dirancang sebegitu. Maksud dia program you have the midwife and then you have a nurse and then there is another one, right? But in Malaysia we only use one. In Malaysia kita hanya ada diploma kejururawatan where dia pelajar perlu menguasai semua sekali. Maksud dia perawatan, midwife, public health and other things. But after you completed in midwife or in perawatan atau in community health for example. So this is a different, okay? But anyway, in response to your question, in the practice, yes, you cannot mix between perawatan and also kebidanan because it's a different function. But in terms of communication, I believe you are same words in terms of advice, in terms of interaction, communication. You are using the same terminology. Okay, for example, like when you look people, for example, like interact to the children, for example, midwife also interact the same, lebih kepada perubatan medikal kan, tetapi midwife lebih kepada how they menyambut bayi ketika bersalin, ibu bersalin, for example, there is a stages. Tapi when we talking about the diseases, the perawatan akan melihat, contoh katakannya bayinya ada jaundice, for example, yang lebih severe kan, mungkin akan diberi kepada perawatan, bukan di kebidanan begitu kan. Dia telah yang itu lebih arif daripada dosen-dosen yang telah ditetapkan oleh Council of Nursing Indonesia. I cannot touch for that, but I believe the communication is the same for both.
Thank you so much.
Okay, thank you.
Thank you. Silahkan, terima kasih ya. Sudah jelas ya. Selanjutnya pertanyaan dari siapa lagi?
Assalamualaikum warahmatullahi wabarakatuh. I'm from Diploma Midwifery. I wanna ask you one question. So, how can personal appearance go into the essential skills? Thank you.
Intan, are you talking about the how?
How can personal appearance go into the essential skills?
Essential
I'm talking
for?
about personal appearance.
Okay.
And essential skills.
All right. Okay. There is two things. There is a different. Okay. You're talking about the appearance and also the interpersonal skill. If you have both, what I mean is a very good interpersonal skills. That one is number one. Okay. Even though you are not good in appearance, but you have in terms of your skill. But to be a good nurse, I believe you have to have both interpersonal skills. As long you have very clean in terms of your appearance to the patient and also to the other peoples, I think that is a more always using a new clothes is a good appearance. Okay, it's not like that, or you wearing all the branded items that will be good appearance. No, I believe all the your rings, your all mask keliling tangan nggak boleh kan? Because you.
2 atau 3 pertanyaan. Oh, masih ada, Prof. Silakan.
Okay.
Yang laki-laki. Oh, siapa duluan? Itu atau ini? Nanti ya. Ya.
Assalamualaikum warahmatullahi wabarakatuh.
Assalamualaikum warahmatullahi wabarakatuh.
Hello, Prof.
Yes.
Introduce myself. My name Nayunda Indika Sari Putri from Diploma 3 Midwife. Yang ingin saya tanyakan, bagaimana salah satu cara untuk memahami apa yang dibutuhkan pasien melalui interprofessional education melalui teknik-teknik yang sudah dijelaskan, Prof.
Can you repeat again the question?
Ulangi dulu lebih dekat coba.
Dekat sini.
Bagaimana cara untuk mengetahui kebutuhan pasien interprofessional education dalam teknik komunikasi itu?
Okay, the question how to ensure that the patient.
Ya, kebutuhan tadi begitu Nayunda ya.
Ya.
Okay, alright. It's a very good question. That's why when we communicate to the patient, for example, patient kita kan ada berbagai mungkin tak pernah masuk ke hospital ataupun mungkin yang pendidikannya kurang. Tetapi the way how we communicate with them is very important. The first thing, bagaimana kita berkomunikasi dengan mereka is very important. How you explain, tapi menggunakan bahasa yang mereka mudah faham begitu. Itu lebih disenangi berbanding dengan kita lebih little bit arrogant menggunakan words yang terlalu tinggi di kalangan ses. We know the level of understanding. Kalau ibu yang datang tu datangnya cakapnya bahasa Inggeris, harus mestilah pengetahuannya tinggi kan. So kita boleh interact accordingly to our patient. First time jumpa mestilah cakap Assalamualaikum, ibu sihat, sakit di mana kan, begitu. Dan kita boleh assess reaksi ibunya begitu bagaimana. Dan dari situ lanjut boleh terus answer your question.
Ya, terima kasih, Prof.
Okay, terima kasih.
Oke, terima kasih. Masih ada satu lagi, Prof. Ini dari laki-laki, silakan.
Okay.
Dari
Yang terakhir ya.
Oh, oke, terakhir silakan. Silakan. Pak.
Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Okay, good morning everyone. Good morning, Prof. Maybe before I start my question, the moderator that have give me the opportunity to ask something to you. And as we know, I'm sorry, before I begin this question, allow me please to introduce myself first. My name is Bayu Andriana. I explain a lot of things about our topic today, about professional communication for midwife and nurse. And I heard one sentence in your first slide that say, just because you are talking doesn't mean you are communicating. And actually, I'm really interested with this sentence because as we know that communication is the way to do, the talking is the way to do communication. And in this slide is not. And how to do the best communication between nurse and midwife, even we know that in our country, nurse has schedule. For example, in a day, in the morning is my schedule, and the afternoon is my friend's schedule, and the evening is another student's schedule. And so how to do the best communication with...
Interesting question that you throw just now. We're talking about from the quoted, just because you are talking doesn't mean you are communicating. Okay, that is the way. The way how we communicate, for example, between one to another, the expression. Okay, the important is the expression and also the emotion that we communicate. between 2 or 3 people. For example, in your scenario, as I mentioned, like we have a morning shift, we have an afternoon shift, and we have a night shift, and then we are communicate among us. I am not sure either you also communicate with us, can what I mean, look into it. I believe in the university levels, basically you can communicate to everyone, but frequently to our colleagues rather than other what I mean other profession beside of nurse communicate. But I believe based on the network between during your university levels, you can communicate with other what I mean people based on the professional what I mean profession to others. Did I answer?
Thank you.
Yeah, all right. Thank you very much, Bayu.
Thank you, sir. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Prof, satu lagi ada dari lecturer yang akan bertanya.
Yeah, sure.
Oke. Silakan kepada Bapak Haji Asep untuk memberikan pertanyaan. Mic-nya Pak, punten bilih hilap. Mic-nya belum dibuka.
Oke. Tadi buat dosen yang lain kan banyak tampil dosen di Zoom gitu. Oke, itu kalau ada kesempatan aja lah. Oke, Azil.
Selamat pagi.
Ya, salam kenal Prof. Saya Asep Gunawan dari Prodi D3 Keperawatan STIKes Ciamis. Mohon maaf bahasa Indonesia aja Mas ya. Saya nggak lancar bahasa Inggrisnya. Nah, Prof, gini Prof. Mungkin dari apa yang dipaparkan Profesor tadi tentang interprofessional education, salah satu berhubungan dengan komunikasi. Perbedaan di Indonesia dengan di Malaysia, mohon ada apa namanya untuk perbandingan. Saya mohon pencerahan dari Profesor tentang bagaimana komunikasi yang baik untuk melaksanakan informed consent. Terus keduanya, secara komunikasi, bagaimana kalau ada istilahnya pemahaman informed consent terhadap si pasien yang tidak paham, yang dimana tindak lanjutnya ada penolakan dari pasien. Komunikasi yang bagaimana yang baiknya untuk supaya kita memahami kita sebagai Assalamualaikum warahmatullahi wabarakatuh.
Assalamualaikum warahmatullahi wabarakatuh. Terima kasih Pak dosen. Okay, very challenging question talking about the consent. Basically the consent form will be given to the patient through nurse. However, after discussion perbincangan di antara doktor yang merawat, nurse yang ada di situ yang membuat tindakan management patient and also patient. So basically dia merangkumi kepada tiga profession. Maksud dia doktor akan maklumkan sekiranya melibatkan prosedur ya, yang melibatkan prosedur dan mungkin akan ada berlaku kecelakaan yang mungkin kita tidak ketahui, na'udzubillah ya. Tapi biasanya ketiga-tiganya kena ada di situ dan tindakan akan dilakukan di peringkat nurse. So maksud dia nurse akan maklumkan daripada perbincangan terdahulu patient akur ataupun tidak akan prosedur yang akan dilakukan. Walau bagaimanapun di sini nurse memainkan peranan yang penting untuk memastikan patient menerima rawatan secara direct. Apa yang akan dilakukan. Kita akan sedikit bercerita kepada patient, okey, kita akan buat macam ni. Maksud dia kalau kata kita juga macam ni selalunya akan maklumkan selalunya by pengalaman patientnya tidak apa-apa sebab kondisi patient mungkin dalam, tetapi kalau patient memang ada dalam keadaan yang critical ill, ini harus dikonsult bersama relatifnya juga untuk pastikan relatifnya memahami supaya kalau berlaku kecelakaan itu semuanya terima dengan hati yang terbuka begitu, supaya tiada nanti argument ataupun pointing orang kata diplomasikan secara berhikmah, respect kepada kesemua pihak. Kalau memang saya ada juga passion yang akhirnya memang enggak mau, dan kita kena terima apa yang dimaukan oleh passion lah. Ya Pak Gunawan, itu jawapan daripada saya.
Barangkali ada lagi dari Bapak Ibu yang akan memberikan pertanyaan, baik itu online maupun di sini. Ada pertanyaan Ibu-Ibu? Saya rasa saya akan menyimpulkan dulu sedikit terkait materi yang sudah tadi disimpulkan, bahwa IPA ini adalah kuncinya komunikasi, baik itu bidan maupun nurse maupun persi yang efektif. Kemudian ada perbedaan antara Indonesia dan Malaysia terkait kebijakan-kebijakan konsil kesehatan. Kalau di sana mungkin tarasi yang efektif dan clearly itu tentu by system gitu ya, sistem yang digunakan. Kemudian faktor utamanya lagi adalah membentuk kenyamanan dan privasi pasien, tentu harus kan. Sekali lagi terima kasih banyak dan berikan tepuk tangan yang meriah. Sebelum diakhiri, ini ada sertifikat for you as a speaker. Silahkan, mohon diperlihatkan. Nanti akan kami kirim by email ya, Prof.
Ya, insya Allah. Terima kasih.
Ya, ini sertifikat yang kami berikan sebagai apresiasi terhadap kehadiran Prof saat ini, dan tanda tangani oleh Prof melalui pesan nanti yang akan disampaikan oleh operator di kolom chat. Dan untuk teman-teman yang dihadir secara online juga sama, mengisi berita acara melalui nanti. Sudah ya? Oh iya. Baik, terima kasih banyak sekali lagi dari kami Profesor Nazil. Sampai ketemu di lain kesempatan dan semoga kita semua selalu diberikan kesehatan. Warahmatullahi wabarakatuh.
Waalaikumsalam.
Saya kembalikan kepada Pak Dadi selaku MC.
Oke, sekali lagi tepuk tangan buat Ibu Aul. Sebelum kita tutup, dipersilahkan kepada seluruh audiens yang hadir di auditorium, baik yang melalui Zoom ataupun melalui kanal YouTube STIKes, untuk mengisi presensi kehadiran. Silakan untuk ditampilkan, Pak Adam. Thank you very much, Prof. Nazil, and thank you very much for audience as coming attention. Time to close this event and let's say Alhamdulillah together. Alhamdulillahirabbil alamin. Nasru minallah wa fathul qarib wa basiril mu'minin. Wassalamualaikum warahmatullahi wabarakatuh.
Untuk Prof. Nazilnya ada 2 link, Pak Jayus sudah dikirim linknya ya. Pak Adam, Prof. Nazil sudah keluar belum? Tak, lupa foto bersama. Oh sudah, oh ya. Background ini gitu. Apa gimana? Gak usah ya. Langsung gitunya.